Really, we've been talking about gynecomastia surgery. Tell me what that is. It's man breasts, right?
Exactly, that's right. It's when men develop a feminine-looking chest or breasts. And obviously for a man to have that, it's very emotionally hard, very embarrassed. They can't wear a tight t-shirt without looking or appearing not quite right. They can't go to the beach. So it really does cause a lot of emotional distress.
You know, we've been hearing more and more about teenage boys getting this, and that has definitely got to be difficult for them in gym class, and you know the amount of razzing that kids get anyway. So how young is too young to have this surgery?
Yeah, it's, you know, I have been seeing more and more younger men, and certainly even some teenagers, and that was unusual 5-10 years ago. So when I see teenagers, they usually come in with their parents, and they've been obviously having a lot of emotional issues. A lot of times it takes a year or two even for the parents to realize that the teenager is having these issues, and most of them do have they go to the pediatrician and get their okay from the pediatrician before I actually am willing to treat them.
Is this hormonal?
It's a combination of hormonal and genetics. Some of the teenagers are actually overweight, and if they're overweight, the chest area can be primarily fat and a little bit of gland.
We've actually got some pictures to show folks, so let's go ahead and roll those while you're talking.
And then some of them can actually be primarily gland, and so that's genetics. It's the way the gland is developing. It's for whatever reason more sensitive to the little bit of estrogen they have circulating in their system, and so they develop larger breasts.
Now, we're not seeing any scarring, anything? It just
yeah. So you know, it actually heals. There's a tiny scar underneath the chest, and there's another little scar underneath the nipple. Both these scars heal very well, and that's the best part about this procedure. It's a very fast, quick. Like this young man has the typical gynecomastia. He's got a little bit of fatty tissue and a little bit of gland found on it underneath the nipple and areola. So I do something called ultrasonic liposuction to break down the fat and then make an incision underneath the nipple and remove the gland.
And that will grow back, right?
And it doesn't grow back.
Okay.
It really doesn't grow back.
We have a little bit of